Okay, well, we'll get started. We're just a few minutes over here, but I think we've got everything ready to go. Thank you, everyone, for joining, and I'm really excited tonight. Vox Neuro is a group that we've been extremely fortunate back and forth over the last year and a bit, working with them as they've continued to build this technology. We're extremely fortunate to be running this technology now in our clinic. So we thought it was a good opportunity to have Vox Neuro on a webinar this evening, so that they would be able to really talk at what they're doing, how it benefits us, certainly from a concussion management standpoint. So this evening, we're excited and thankful to have Kyle Ruiter, who's a neuroscientist and vice president of clinical scientific affairs at Vox Neuro. Kyle is the know-all of the technology side behind this, and so we're happy. Thank you, Kyle, for being here, and Christopher, who's the director of sales and strategic partnerships. He's been helping us, really work through getting this in the clinic. Getting our team trained, and starting to work through sort of how we apply this in clinic. So between both Christopher and Kyle, this has just been an awesome experience, and we thought it would be something that we would really like to share with our members, with patients, with anyone who really wants to understand what Vox Neuro is. So thank you, everyone, for joining us. And Kyle, I'm going to turn it over to you, and I'll let you and Chris kind of weave through who's speaking, but we'll get to sit back and enjoy it. So thanks again, and the stage is yours.
Awesome. Perfect. Thanks, Scott. I'm going to throw it over to Christopher to start, actually. So go for it, Chris.
Yeah, you can jump onto the first slide, and thanks, Scott, for the introduction. And I want to welcome everyone. We're going to run through an introduction to Vox Neuro's neurotechnology. Would like to thank Shift, though, for hosting this webinar, and thank everyone who was able to make it out today for joining us. Now, we will be recording this, so any colleagues or individuals that you think in your network that would benefit from learning more about Vox Neuro will be made available on our YouTube channel afterwards. So we're excited to be partnering with Shift on transforming the way brain health is managed today. Shift Concussion Management in Guelph, Ontario is one of the newest Vox Neuro test centers, where someone can actually go in and get a cognitive health assessment. So we'll be talking through these agenda points today and giving an introduction to Vox Neuro's breakthrough neurotechnology, going through what is a cognitive health assessment, how Vox Neuro is different from some of the other cognitive assessments out there, but also the other neuroimaging assessments available in the marketplace. Go through the applications of Vox Neuro and the different types of individuals that are receiving assessments today. We'll hand it back over to Scott and Kaylin to really speak towards how Vox Neuro is being used at the Shift Clinic in Guelph. We'll go through a few frequently asked questions, and then we'll open up to a question and answer session for everyone who would like to type in any questions that they may have lingering once we've gone through Vox Neuro. So go over and give a quick introduction. So Vox Neuro is a data-driven Canadian neuroscience and health tech company. We're positioned to globally change the way brain health is managed and treated. We are based out of Hamilton, Ontario, very proud Canadian company out of McMaster Innovation Park. With our rapid, precise scores of cognitive function, we give the brain a voice. And so we are bringing to life what has usually referred to as the invisible aspect of an injury. So Vox Neuro's proprietary 15-minute evidence-based EEG protocol is what we refer to as the cognitive health assessment. It scores multiple core cognitive functions by comparing a patient's event-related potentials. And we compare those event-related potentials to our normative database and then determine the cognitive function scores in memory, information processing, attention, and concentration. This application is limitless from a brain health perspective. It is available to anyone today in Ontario and very shortly as we expand across Canada and into the US to more individuals. But those aged from 12 years old up to 90 years of age. We are backed by 30 years of peer-reviewed studies and research. Some of those studies led by Dr. Kyle Ruiter, who I'm going to momentarily pass it over to him. And we are a Health Canada cleared lab developed service, and that's how we're operating in Canada today. As Scott already introduced, Dr. Kyle Ruiter, Vox Neuro's Vice President of Clinical and Scientific Affairs. Over to you.
Awesome. Thank you very much, Christopher. Just had to find that mute button as always. So first thing I'm going to talk you guys through is just essentially what is the cognitive health assessment? What does the patient go through? What is the time that's involved, etc. So firstly, as Christopher mentioned, this is a non-invasive EEG assessment, and the task itself that we have the patients go through is approximately 15 minutes. So the setup itself takes about 10 minutes. The first thing that we actually do is measure the head to fit either a cap, which we have used previously and we can still use, or what we've moved to today is individual electrodes. And this is what is set up at Shift up in Guelph today. And the reason we have moved from the cap to the individual electrodes is because it's more inclusive of being able to test everybody, including different types of hair, as well as different skull formations in case somebody has a bone flap, for example, and that they have a part of their skull removed. So first you measure the head, you determine where the center electrode is to go, and then based on where that center electrode is, you can then map out the remaining 8 electrodes that go across the scalp, as well as above the eye and behind each of the ears. To actually apply the electrodes onto the scalp and around the face, you use a couple different types of gels. And the first gel is really just kind of like an ultrasound gel. And you use this gel first, you just kind of scratch the surface where that electrode is going to go on. And then you add a little bit of this thicker paste that you put into the electrode itself, and you stick that directly onto the scalp, as you can see in image 3 at the top, or actually I guess it's really image 5, but on the right-hand side. You then do that, like I mentioned, for another 8 times for a total of 9 electrodes. And then you connect those electrodes to the amplifier itself. Now, is good is that this, although it's kind of a sticky paste, with water it comes out very easily. So you don't have to worry about going around with goop in your hair for the whole day, as long as you give yourself a quick rinse. So with that, if it will go to the next slide, there we go. Then you have the assessment itself. So here's a good example of what the example or what the test looks like, or the setup looks like at a test center. So you can see it doesn't really take up that much space. There's a number of different ways to do it. You don't actually necessarily need a desk setup as well. With our newer hardware manufacturer, you can have it as a standing desk, and it's mobile. You can cart it around, etc. And you can see, like I said, it takes up a small space. You don't need a large room or anything to do it. So with the assessment, like I said, takes approximately 15 minutes to complete, and it consists of 2 tests that measure 3 different cognitive functions. These cognitive functions being the attention and concentration, information processing, and working memory. The attention and concentration and information processing cognitive functions are measured through an auditory task where patients are asked to differentiate between different types or different sounds that they hear. This test is approximately 10 minutes, and really they're going to be hearing different sounds, and what we ask them to do is differentiate. When they hear a sound that's different, they click one button, and if they hear a sound that is another one, they click another button, for example. The second test is a working memory specific test that requires the patient to differentiate between images that are new to them and images that have been repeated. And this is approximately 5 minutes in length. Now, for example, just to give you an idea of what that test really is showing. So for example, the patient will be provided or presented a triangle and then they'll be presented a circle, and then they'll be presented a triangle. Now, the first time they saw the triangle, they would say, this is a new image. They'd click one button. The circle was presented. There's a new image. They'd click one button. Now, the triangle was repeated. It's the second time they've seen it. Then they would differentiate and click a different button saying that, oh, I have seen this image before. And so this is really being able to assess the patient's ability of working memory and how well they're able to store information and hold it while they're looking for that image to repeat. During the assessments, what makes us different from traditional cognitive testing is that patients perform these tasks on a computer while the electroneurophysiology is recorded simultaneously through the EEG amplifier. So in traditional cognitive assessments, you might be using it on an iPad or just a pen and paper test. There is no neuroimaging or neurotechnological component associated with it. And this is really the differentiator that Vox Neuro brings, because we're not measuring the behavior or the subjective nature of those responses. What we're measuring is your brain's responses to the stimuli that are presented to the patient. Now, with that, what we see from an EEG perspective is what we call event-related potentials. And these event-related potentials, or ERPs, are indicators of the health of core cognitive functions, such as the memory, information processing, and attention. The example on the screen here is what an ERP looks like. The red line indicates what the average healthy neurologically functioning person should look like, and the black line represents an example patient where they are not performing quite as well as what they should for their age-matched cohort. So the attenuation in the waveform size in that black line indicates a reduction in overall electrical activity, and thus demonstrates a lower level of cognitive functionability relative to their age-matched cohort. So again, you can see the age range for someone who's 49. We compare them to individuals between the ages of 40 and 59. This is very important because we can't be comparing, for example, somebody who's 49 with somebody who is 18 years old, because naturally, as you grow older, your cognitive function naturally declines over time. So we have to make sure that we are comparing these individuals to those of a similar age range. And ultimately, what happens if there is a reduction in electrical activity, as can be seen here with the black waveform, is that this is really one of two things that is occurring. This is either a result of a lack of neural tissue actually available to generate the electrical activity and the firing of the neurons itself to perform, or it's because the neurons are firing asynchronously, and ultimately the signal, the electrical signal, is not radiating in a synchronous manner to be assessed. So both these things result in a cognitive function potential deficit, or at least an inefficiency in cognitive processing. Now, just to dive just a little bit deeper into the example that is on the screen here and what you are actually looking at, because I understand this is a little bit more complex, is that each peak and trough of the waveform, so hopefully you can see, oh, you can see my mouse. Okay, so for example, the N1, N2, and P300 here, so each peak and trough of the waveform will represent a different cognitive function. So for example, the N100 on the left here is a representative of auditory and visual processing, so ultimately sensory processing. The N2, so the next peak here on the top, is a representation of information processing and executive control, while the P300, depending on the task administered, is a direct reflection of either working memory or attention and concentration. Now, I understand that looking at raw EEG data is complex and it does require a fair bit of expertise. So as a result, what we do at Vox Neuro is take these neuromarkers, so these ERPs, and display them into an easy to read score on the first page of the report. So here are the first 2 pages of the report. report. So you can see we don't put in the actual EEG waveforms. We transform those waveforms into easy to read scores and these are the 2 pages that are most important for you, the clinician, as well as for the patient itself in understanding what is that patient's level of cognitive function and how is that tracking over time. So to dig just a little bit, oh, I hope everyone can hear me okay. I just saw that Scott just asked if everyone can hear me, so I hope everyone can hear me just fine. But moving into the next slide here. So this is the first page of the report. You can see that we provide a score out of 100 for cognitive function level, where a score of 50 is average. Anything above a score of 60 indicates an above average level of cognitive performance, while any score under 40 indicates a below average level of cognitive performance. So this is an example of where so for example, a score of under 40 is where a clinician may want to employ a certain type of treatment to ensure that the patient gets better and gets back to that average range. Now, this method of scoring is what is commonly used in both psychometric and neuropsychological assessments. It is very widely accepted within the psychology professional realm. So this is one of the reasons why we went with this type of scoring method. So it's an ease of adoption, and hopefully a number of individuals within this space would already be familiar with this type of scoring method. So with that, let me take this time to kind of explain this example that we see here on the screen. So you can see for this patient in particular, they have an attention and concentration score of 54, which is perfectly right in that average range. So not really anything to worry about there. In the information processing cognitive domain, they are slightly above average, which is great news. That means they're really scoring above what the average person is typically scoring. And again, information processing really isn't a concern. However, we can see here in working memory that they have a score of 39. Now this is starting to it does fall below that average and goes into that low category. Now what this enables a clinician to do is be able to see that, okay, now this person has suffered, for example, let's say a concussion, and in 2 of the cognitive domains, they are still scoring very strongly. However, in working memory, they're scoring very poorly. So now they can focus their treatment around trying to improve that working memory. Now, of course, this is more specific to, for example, cognitive rehabilitation therapists, whether neuropsych, occupational therapists, etc. Now, I understand a number of the clinicians on the call are physiotherapists, chiros, etc. Now, we all know that physical therapy itself can absolutely help to improve overall cognitive function, but what this can really help you with, if you want to zone in on one particular cognitive function, is just understanding how to interact with your patient. So if you know now that working memory is lower for this individual, you may understand, well, you know what, I'm probably going to have to repeat myself a few more times for this patient to make sure that they can really grasp the concept of the type of therapy that I want to employ for this individual, for example. And below that, we can see in it's probably a little small writing for you guys here, but ultimately we have a line that says the patient processed the visual and auditory stimuli. There may be clinicians on this call today that focus on visual types of therapeutics, which again has been shown to have great results with those with concussions. However, I want to make sure it is stated clear that we do not assess the level of visual or auditory processing ability of the individual. We use this as essentially a quality assurance on our end to ensure that the patient did in fact perceive the stimuli that were presented to them. So if, for example, they close their eyes during the working memory test, which is a visual test in nature, then we would know that there would be no cognitive response, but there also would be no visual response. And then we know that they didn't actually intake any of the stimuli itself. So moving on from this example here, we can move on to what would be the second page. So this is one example of the 3 cognitive domains on the second page, specifically attention and concentration, but it shows you the progress of this particular patient's cognitive performance within attention and concentration throughout different testing times. So this can help you as the clinician kind of understand, what has been this patient's journey to date in terms of cognitive function. They had their injury, they're still scoring kind of average, but they realized that there were, a month later, they're not feeling right. They go in for a second assessment, and then of course, then it's showing a lower score, and then they've decided, let's try maybe a different type of therapy, or maybe the therapy just is finally starting to work in their favor, and they're starting to recover quicker, and we're getting back to that normal range and starting to improve over time. Now, on the right-hand side, you will see just a very simple legend to talk about, cognitive performance was remained consistent, if it has improved or declined. And of course, if this is the very first assessment, this would of course not be applicable. In order for a result to be considered improved or declined, it has to move at least a score of 3. So for example, if they scored 50 on the first test for a particular cognitive function, on the second test they scored 53, that would mean they will show an improvement. However, if they scored a 52 on the second, it would say remain consistent. So essentially there's a plus or minus 2 wiggle room of what will remain consistent, and anything beyond that will consider an improvement or decline. So just to kind of hammer it home again, if the first test was a score of 50, and the second test was a score of 47, then of course this would demonstrate that there had been a decline from that 50 to 47 score, for example. So again, this is very useful on understanding, how's this patient doing cognitively, and what types of methods and therapeutics and interventions are being done, and which ones are potentially working best for this patient. The final 4 pages of the report is essentially partially going over what I just went over with you, but at least you have a reference point, as well as some legalese and some better and more in-depth understanding of what we do. So on page 3 in particular is really an interpretation guide of those first 2 pages that I just walked you through. The page 4, it goes over the event-related potentials, those neurophysiological markers, how we take that EEG data and put it into a simple, easy to read score, and how those scores correlate to the labeling that we have and the legend that we have on the first page, and that is in the table at the bottom of page 3. What's important to note is that this ERP waveform is an example. This is a static content that is always there. We will not be showing the patient's event-related potentials for each individual patient. We show just this as a static content. Now, of course, if someone really wanted to know it from a clinician standpoint, if we're working with a neurologist, for example, we can happily provide that information for them. But typically, this is kind of just beyond the scope of what is needed to help with the patient and guide their treatment plan. On page 5, we have explanation and information on how we come to that T-score method, or that scoring method, on the first page. So these are traditional T-scores. Like I mentioned, this is what is used in psychometric data analysis as well as psychological testing. But maybe you want to know just a little bit more information. What does a 70 mean in terms of a T-score, and how is it transform into, for example, a percentile? In this case, a T-score of 70 means that they are the 95th percentile, and that means that they scored better than 95% of the population within their age-matched cohort for that particular cognitive function. So it just goes into a little bit more depth about the statistics and the methodology that we use behind our scoring method. And then lastly, we have it's really an indications for use page. How is this product supposed to be used? It provides our legalese, our regulatory wording, etc. So it's just to inform you, essentially, this is a tool that is providing you, the clinician, with objective data that can help you create or help you make more informed decisions. Now, often the question that we get is, how are we different? How is Vox Neuro different from, from the other types of neuroimaging and neuropsych assessments out there? So I'll quickly walk through this. So we have MRI and CT. And of course, these are perfect for structural assessment. This really dives into, does this person have significant neuroatrophy, so shrinking of the brain, or significant neurodegeneration? Has this person had a brain bleed, a stroke, a tumor, etc.? It's very much reliable. It's a diagnostic. However, it doesn't really help to inform rehab outside of that initial diagnosis. Second, you have a neuropsych. So again, this is not structural. In fact, it's not even a neuroimaging technique, of course. So it's not structural or functional in nature. However, it does assess cognitive function due to the fact that there is no neurophysiological or biological measure. It is subjective in nature. However, it has been shown to be quite reliable. It's typically used as a diagnostic, and it certainly helps to inform rehab and certainly helps in terms of being a rehabilitation and therapy tool to get patients back on course and get patients back to health faster. One of the problems with neuropsych assessments is often it doesn't occur until 6 to 12 months post-injury. And of course, this is then not assessing those acute issues at the very beginning stages of the injury. Next, you have fMRI. fMRI made quite a splash in the early 2010s about being this new sophisticated assessment of neurophysiology. And despite its name being functional MRI, it doesn't actually measure cognitive function. What it actually measures is blood flow in the brain. And until very recently, it was considered to be quite objective and reliable. However, a recent study published in 2020 in Nature, and for those unfamiliar with peer-reviewed journals, Nature is genuinely one of the top published or peer-reviewed journals in the world. And this was published by a leading fMRI researcher who has done this work for, I want to say, almost 30 years. And he realized that, when it comes to evaluating traumatic brain injuries in particular, that there is a lack of reliability and validity when it comes to fMRI. And he concluded this by sending the same data set of traumatic brain injury patients' data to 70 different fMRI analysis locations, and they all came back with different answers. So this really kind of put a hole in, what are you really assessing if every single time you go get an assessment, if you get an assessment in Montreal, you go get an assessment down in Buffalo, you're going to be getting a different result on your level of neurological function, for example. So one thing that is great about our method here at Vox Neuro is that no one else does exactly what it is that we do. So we don't have that issue. And the pieces of our product that are similar to others, we all follow the same rules that were set out actually by the guy's name is Dr. Stephen Luck. And he's kind of known in the EEG ERP world as that so-called grandfather of that type of EEG analysis. So everyone follows along what he does. And if you're doing something different than that, then you're going to have to, reassess the reliability and validity of that method. So just to dive a little bit deeper into Vox Neuro itself, of course, we're not structural in nature. We're not measuring the structural integrity of the brain. We are measuring the cognitive function through a functional assessment. We are very much objective, very much reliable. Now, importantly, we are not a diagnostic. We are not trying to be a diagnostic. We want to help inform rehab and help those with a brain injury and help the clinicians tailor the treatment towards those with a brain injury to help them get back on the path to recovery sooner. Realize that I've accidentally whited out the best time to use our assessment, but the best time to use it is anytime. That's one of the benefits. We can be used in an acute state. So if the injury just occurred, or we can be used in a more chronic state, or we can be used in general aging, neurodegeneration. It doesn't have to be a recent injury, but it also can be a recent injury. I'll try to speed through here on this last one so that I can give other people an opportunity to speak. So how are we different from some competitors that do similar types of work to what we do? Firstly, we measure more cognitive functions than any of the others. Again, as I've mentioned, this enables clinicians to get a better understanding of the individual's cognitive health and how they can tailor treatment, or at least tailor interaction towards their patients. We are used to inform diagnosis. Again, we are a data point that helps a clinician make a decision. We are applicable to all neuro applications, whether it's just general cognitive health. We've had people come in who just want to know their annual checkup. How's their cognitive health? We've been used in neurodegeneration populations, of course, concussion, traumatic brain injury such as comatose patients, vegetative state, etc. Again, helps to inform tailored treatment and rehab. We do not require baselines, as we do compare an individual to their age-matched cohort from ages 12 to 90. However, we can do baselines. Obviously, this is important in the professional athlete space, or just high performance athlete space, I should say. What's their functioning preseason? What is it postseason? What is it, preseason, and then what is it after a concussion, for example, in the middle of the season, so that they can have an understanding of where their level of cognitive function is, and how and to what point can we get back to that average range, so that they can go back out and play, or get back to work, etc., whatever the case may be. Again, this can be administered at any time. One of the big benefits that we have is that we are hardware agnostic. We utilize existing Health Canada and FDA regulated medical device EEG hardware, so we can layer our assessment on top of it, whereas the other competitors here are stuck to a specific type of hardware, and specifically they all use a cap. And as I mentioned before, this limits the populations that you can actually assess. Anyone with type 4 hair, for example, can be, with a lot of type 4 hair, I should say, can be very difficult to test with a cap. And of course, anyone with any abnormal skull formation is very difficult to test in that manner. And then lastly, we are able to operate in Canada as a lab developed service today, and we are just a couple days away from our Class 2 medical device clearance here in both Canada as well as in the US. So with that, I will leave it at that, and I will take a look at your questions so I can preemptively get them ready for answers at the end of this presentation.
Thanks, Kyle. All right. So now that Kyle's taken you through the assessment process and the results, I'm going to dive into a few different applications. And I saw some of the questions coming in and asking if the assessment is concussion specific. So the cognitive health assessment provides data on an individual, scores an individual's cognitive function. Now, what you're probably thinking is that there are a number of different adverse events, injuries, diseases, disorders that do affect cognitive function. And so the most common application that we're seeing today is the reactive market, where there has been an adverse event or diagnosis, and the primary focus is around treatment. And so those range from concussions and traumatic brain injuries to COVID-19, dementia and Alzheimer's and other neurodegenerative diseases, the mental health space and mental health disorders. And then we go into some other secondary focuses and understanding, what is the effect and understanding of the effect of different treatments. So, for instance, how has a specific cancer treatment affected an individual's cognitive function, and or some other type of diagnosis that is causing some sort of functional deficits. I do want to point out, I know COVID is on a lot of people's minds because it's keeping us inside and keeping us on the webinar today, as opposed to doing something like this live. But there was a recent study, so we do list COVID here. A recent study just indicated that 1 in 3 Americans diagnosed with COVID, this was a study of 230,000 Americans, 1 in 3 were diagnosed with a brain or psychiatric disorder within 6 months of recovering from COVID. So just to think about all the far-reaching applications from a reactive market perspective. On to the next slides, Kyle, just talk through and give an understanding, especially from us understanding of where Vox Neuro fits in that patient journey, or if it's coming from a healthcare professional from the referral process to one of the testing centers. And so if a patient does require a cognitive health assessment, they would refer to the testing center, one of those testing centers being Shift Concussion in Guelph. The patient would go there, get the assessment run. Those results would be returned back to the referring clinician to review the reports and go through the results. And then if in conjunction with this and the other assessments and the professional opinion of the healthcare provider is that they're ready to return to activity, then they return to activity. In the event that they require rehabilitation, they move forward with the rehabilitation intervention program. And then Vox Neuro is available for a follow-up assessment, as Kyle talked through. We can track an individual's cognitive function scores over time and understand how an individual is progressing, whether that be post-rehabilitation or other types of interventions that can be prescribed by the healthcare professional. On to the next slide, Kyle. When we think about other areas, I know there was a question about athletes pre and post season. So the other applications that we're seeing from Vox Neuro's perspective for cognitive health assessments are broken up into three other areas. The wellness and proactive market, so whether that be senior wellness, executive health, employee wellness, and or just that annual touch point and checkpoint to understand how is my cognitive scores, and is there any sort of red flags coming up in the cognitive health assessment that may lead to additional testing, may show that there is no areas of concern, or that there is some sort of rehabilitation that goes in conjunction with the other assessments that have been run. The other areas are the data market. So when we talk about understanding the efficacy of different treatments, that can be applied to not only rehabilitation interventions, but also clinical trials and in the research realm. And then the last market, on to the next slide, is the active market. And so there was a question specifically about that, and Kyle touched on this around the pre-season and then after an adverse event or post-season. But that can be extended further to not only just high-performance athletes and athletes in general, but other high-risk jobs and employment, whether that be police or fire or military, even construction. And so having patient-specific cognitive scores in the event that an adverse event does occur, and this being an active market, these are individuals that may be more likely to or at greater risk. They can come in, have that reassessment, and on that assessment, have their individual cognitive scores tracked over time. And then it similar fits into that patient journey that we spoke about earlier, where there's the report review, some sort of rehabilitation, or a return to activity. So I'm going to pass it over now to Scott and Kaylin to speak specifically about Vox Neuro at Shift. It's been a couple months now, and let them speak about their experiences and how they're using it in the clinic.
Perfect. Thanks, Chris, and thanks, Kyle. That was great. I'm gonna be quick on this because I know we have an awful lot of questions here, and there's some really great questions, and I think for the purpose of conversation, the questions will lead through that. So I'm excited to get into those. I think for those that are, from a clinical perspective that are listening to this, one, when we started talking with Vox Neuro about this, for everyone who's been a part of our program and our course, we've always heard us talk about that invisible injury. being concussion. And what I really liked about where Vox Neuro was going is it started to change that invisible injury thought process, that we could really be able to look at brain function in a way, that we maybe had never been able to look at it before. For those that are involved in the program, they know that we've looked at different types of testing in the past, and they come with a variety of different challenges and complexities to it. Vox Neuro was just one that really was simple but precise. It really allowed us to see what was happening with the brain. It was intriguing to us because one of the things we've always wanted to look at was what was our treatment protocol. We're looking at this. How much of a difference are we able to make? And so in bringing Vox Neuro in, we've been able to see clearly on an objective level what is happening. We're also able on sort of retest as we move through this to really see what the work that we're doing and how it's affecting, the patient. So I really like that. I think interestingly, as we got involved more and more with Vox Neuro, we realized that there was more than just the concussion space for us. Brain health and where your brain health is an important part. Certainly for me on a personal level, as you start to get to my age with aging parents, you start to see that becomes a significant component in our aging population when we're starting to look at Alzheimer's and dementia and stuff. And Kyle, you and I have had many conversations around this, but understanding where is that brain health, what can they do, what can't they do. With Kyle and Chris, we've been working with the CFL alumni in talking to them and some of their former players that are struggling. So from an athletic standpoint, of people that have maybe had multiple concussions over and over and are struggling later in life. I really like the idea of being able to look at this as something that might have an early detection for some of these injuries, but also maybe setting up those baselines for those maybe more elite level players. So for us, this has been a really fun, relationship with Vox Neuro. We're just getting, our feet wet with it. It is something that we're just getting through the first rounds of testing, really understanding it, and continuing to work with Chris, Kyle, and the entire team at Vox Neuro. So we were just excited for us to have it there, but excited for our membership and patients and anyone that's really watching to see what this technology is and how beneficial it can be. So I think as we move on, this probably will be a webinar that we will look at having later down the road, talking more about our clinical experiences as it relates to patients. Right now, we're through a handful of people. I mean, we've obviously read a lot of the research from Vox. We've been able to do that. So I look forward to when we can really sink our sort of a webinar into some really good case studies and case scenarios, which obviously we're working on and continue to work on. So Kaylin, maybe what I'll do is kind of just pass it over to you. We'll keep Kyle and Chris here, and maybe I'll get you to sort of run through the questions that we have here, and whoever we want to pass it on to, or whoever you think should get it, why don't you pass it on to them?
Yeah, well, I think Christopher, you have a few more slides to go, do you, before we get to questions?
I just have a couple frequently asked questions that I'll go through that might address some of the questions that were coming in. So obviously one of the questions is, how do I refer? So you can visit voxneuro.com/locations and download and send a referral forms to the test center. So there it shows Shift as well as the other test centers that offer Vox Neuro's cognitive health assessment. So that's how you do refer. One of the questions did come in that if it is OHIP covered and overall what reimbursement options are available. Today in Ontario, the reimbursement options are extended health benefits, motor vehicle accident insurance benefits, health spending accounts, workplace insurance, and then private pay. So it is not currently covered under OHIP, but there are a number of other options for reimbursement. And then a common question is, how do I know if a cognitive health assessment is right for me or my patient? So kind of the 3 points here are you or your patient has suffered an injury, and you want to confirm if cognitive function has been impacted. You or your patient is experiencing cognitive difficulties, or you want to measure how your brain is performing as a proactive health measure.
And Chris, I'll just jump in on that as well, because in our short period of time, and for those from a clinical background, we have been able to use this on a few motor vehicle accident claims. It has been approved by the adjusters, so we are seeing that is a possibility. Certainly, when we start talking about support for both motor vehicle accidents, WSIB, or any disability-based claims, the one nice part about what Vox Neuro has is that it is purely objective and scientifically backed. We're not seeing a lot of pushback from that. I don't know that holding our breath on OHIP would ever be a great idea. They're not in the process of adding to, they're in the process of taking away. So, but yes, extended healthcare, certainly spending, healthcare spending accounts or private pay seem to be kind of, those are the most obvious, but we are seeing, and I don't know, Kaylin, if we've had any through WSIB approved or not, but certainly I know from an MVA perspective we have.
Yes, yeah, we haven't put any through WSIB, but Christopher, there has been some success at other testing centers, is my understanding. So hopefully this is something that we will get support for, and it certainly makes sense. It's another objective assessment piece that helps us direct rehab and get our patients the treatment interventions they need faster, ultimately, is what we're trying to do, and get them a faster recovery as well, obviously. So
we're obviously here, to work with anyone as well. To if there is some sort of other reimbursement option that hasn't been made available, or when we look at some of the other applications, whether that be employee health or whatnot, and you're thinking this would be a great fit for your organization, engage us and let's start the conversation and understand how we can work with you on making this more available to as many people as possible. We're passionate about the the immense value in the data that Vox Neuro provides, and we're here to work with all of you.
Awesome. Okay, well, let me get into a few of the sort of scientific questions maybe first, because there are some really good ones. And I'm going to put this out to you, Kyle and Chris. So one question, how do you verify that the decrease or lower cognitive function is in fact due to an injury and not from another neurodegenerative condition if there isn't a baseline?
Yeah, that's a great question. So today what Vox Neuro does is measure cognitive function inclusive of all variables, and that includes all comorbidities. So in the future, what we want to do at Vox Neuro is be able to disentangle, is that cognitive decline really the 3 years this patient has been diagnosed with major depressive disorder, or is it from that concussion that occurred 6 months ago? We're not quite at that point as of yet. We really want to be. With more data, we will be able to. But today, it's a measurement of what is this patient's level of cognitive function, and how can we improve where we are seeing deficits in that? That is a great question. Definitely something we are working towards.
Yeah, that's perfect. And someone else just looking to have a little discussion about retest reliability. Obviously, it is very reliable. I'll let you speak to that too, Kyle.
Yeah, no, another great question. We do have excellent retest reliability. In fact, we've actually had to perform that type of testing ourselves for our FDA registration for down in the US. But in addition to that, there has been a number of studies, and we can provide these studies where ERPs are used as clinical assays for different types of research and clinical initiatives. So absolutely, they are very much reliable. Of course, people will vary to an extent. This is why we have that threshold of that ±2 in terms of the scoring. But ultimately, it is fairly consistent over time. And I know there's another paper that I'm forgetting the author, but essentially shows, every 10 years, there's a certain X amount of cognitive function decline that you can measure through ERPs in particular, for example.
Okay, great. And then just on the testing process itself, can we use this test on those that have dementia or Alzheimer's?
100%. Yeah, I highly recommend it, especially this is where, that retest component really comes in, has that significant value. Understanding what is that progression level in terms of that decline. And, if you're putting that patient through certain types of rehab or intervention, maybe you they are going through it and you're starting to see that that decline is now starting to slow, which is obviously great news. And then that this type of therapy is really, having a positive impact on that individual, for example. But absolutely, I would highly recommend this be used in any sort of dementia or Alzheimer's patients.
Perfect. And then a similar question, could it be used for those suffering from ADHD? And I think absolutely similarly, it's something that we would want to track over time as cognitive performance, especially if there are, any concerning deficits or treatments that we can apply to improve that in that patient population. So for sure. Another really great question about athletes and sandbagging.
Yeah, I love this question. Yeah. So this is one of the benefits of our assessment is you can't sandbag it. You can't purposely falsify your results. This is because when we are assessing you, we are not assessing your behavioral response, whether or not you got that, if you correctly identified that that beep was different than the other beep, or that image you hadn't seen before, or whatever. So if you're purposely trying to falsify, your brain is much quicker at responding than, it getting all the way down to your motor ability and actually performing the behavioral task itself. So we're not at a state or not at a point in time where I believe anyone can manipulate their own brainwaves. So ultimately, this removes that sandbagging effect and is really beneficial when it comes to, insurance claims, when it comes to malingering, for example, because obviously people do try to fake injuries, and of course this surpasses that. But it's a great question. I love getting it.
Okay.
It gives that objective data point and ensures that the athlete that is really wants to get back out there, have they truly improved from a cognitive perspective, to match that up and make that informed decision of return to work, return to play, return to activity.
Awesome. And then I just see here one of our members, Sharmila, looking for research papers that we can put on the membership site. And absolutely, we'll do that after the webinar. We'll make sure the recorded webinar as well as some scientific literature goes out to our membership. So we'll be sure to do that. And I think for questions, that's all I have. Oh, there's one more that came in here. Sorry, Christopher, just one about language barriers. Are there any concerns about language barriers?
No. The only language barrier would be, really just the explaining of the test to the individual. So if you're not familiar with the language that they speak, that could be the language barrier. But in terms of the actual testing and the results from a cognitive performance standpoint, no, there is no language barrier.
Perfect.
And Kalen, there was one more I thought that was really that I thought was really good was will there be any effect or change with medication or use of medication during the testing?
Yeah, so individuals who are on some sort of medication that affects the CNS, whether it be benzodiazepines or some other type of pharmaceutical drug, these ultimately do affect cognitive function as a whole. And so you can understand that, certain individuals, if they're on this medication, may be performing lower in the cognitive ability because that is a side effect of the drug itself. And again, this kind of ties back to that first question of, is that cognitive decline due to the injury or is it due to the therapeutic intervention? And that's still something that we are working towards. But again, we provide how is this person functioning overall, inclusive of therapeutics or drug intervention or otherwise.
Great.
Okay.
I wrote down one question from the comments. Kyle, does the auditory testing take into account those with hearing deficits? I don't know if we covered that one yet.
Yeah. So if somebody is deaf, they will not be able to do the auditory assessment. That being said, you can adjust the volume on the assessment. So if someone is harder of hearing, we can turn up the volume for them to do it. Now, of course, you're going to have to rely when you're doing the assessment on asking them, can you hear this or not? But fortunately, on the back end, when we do our analysis, we will be able to tell whether or not they did in fact hear it. And if, for example, we do not see, if you recall, that N100 response, that sensory response, if we do not see that on our end, that means that they did not actually hear anything that occurred and ultimately could not perform that cognitive function. So again, it's just important to note that, if there is some sort of hearing deficit, hopefully they can hear, but otherwise, obviously, if they cannot hear it, they cannot perform that task in particular.
Okay, and then just people looking for testing centers now. So Ottawa, Aurelia, Barrie, where are your
yeah. So test centers are mostly in Southern Ontario today, with the new one coming in New York in a short period of time. But we constantly update our locations page for new test center locations. And that's where you can find the referral form, as well as all the different clinics' fax information, email addresses, and phone numbers. And you can always contact us on our 1-800 number as well for any other questions.
Great.
Perfect. Okay, I think that's all the questions that we have. So you know what, we're perfect on time. So I'd like to thank everyone for attending. Kyle, thank you. Christopher, thank you. This was great. I mean, even nice for me to sit back and hear it again. So it's always a great refresher. For anyone else that's out there, if you have any additional questions, please feel free to reach out to us. We certainly can. I know as many will, get away and digest this, have something that they might have later. Feel free to reach out and we can help you. But thank you, Kyle. Thank you, Christopher. And I hope everyone has a good evening. And I think that's it.